Hi guys, hope you're well. Welcome to day 9 of the Arora AKT 30-day challenge. I hope you're having a good day. Hopefully you're ready for another clinical question tonight. If you've been following us from days 1 to 8, you know we're doing a real-time question every day to get you to keep your preparation on track, even on those days where you haven't had a chance to do lots of work. Hopefully you can do this single question just to keep you learning bits from a knowledge point of view, but also technique point of view as well. So without further ado, let's go into today's question. As always, 57 seconds to match approximately what you'll get in the real AKT exam itself. I'm going to change screen, start the timer, see what you think, and we'll join up again on the other side to give you the answer and some teaching as well. Let's go. Okay guys, that is time, 57 seconds. Right, so question about breast cancer referral then, and one thing or suspected breast cancer referral, one thing we talk a lot about is making sure that you know your NICE 2015 urgent referral suspected cancer guidelines inside out for something like an AKT. These should be things that stand out in primary care as things that make us worry about cancer and get, of course, people into the system as quickly as possible. So you want to be picking these up and knowing them. We have videos on our YouTube channel for pretty much every system out there in a condensed format. So try and find them and watch them and make sure you know those ins and outs. And it can be quite challenging because there are lots of ages you have to remember. There are lots of particular things across all of the guidelines. It can get quite confusing. And we'll talk about all the breast cancer ones in a second. But the answer was A. The only one that you need to refer is A. So you're reviewing your five most recent urgent referrals to breast clinic to rule out suspected breast cancer. Which of the below referrals correctly matches the NICE 2015 urgent referral guidance? The only one that fits the guidelines is A 34-year-old with unexplained painful breast lump. Now, some of the other ones you may look at and think, okay, I'm a bit worried here about cancer, and you may ultimately end up referring them as an urgent basis anyway, but they don't match the guidelines. And for an exam like AKT, you need to know the guidelines inside out, and therefore the only one that's correct here is A. The other four, we'll go through why in a second, do not fit the current guidelines. So make sure you do go over the guidelines for all of the cancer referral guidelines, like I mentioned, because it's kind of bread and butter for something like an AKT exam. And I do see, particularly when people do our mocks, a lot of marks are lost on these types of questions, and there really are questions that you want to get in the bag, really, when you've got such a vast array of other questions that have a lot of vagaries about them. Okay, let's talk about breast cancer then. So of course presentation varies, but you've got your classic presentation that should stand out in a question. Breast lump, of course, armpit lump, change in breast size, some kind of nipple change, and then skin change as well, things like dimpling, for example, but lots of other skin changes can happen that may make you or should make you think about the possibility of an underlying breast cancer. Lots of risk factors that may pop up in questions. Of course, they don't change what you do from a management point of view, but they should be there kind of triggering thoughts whereby you may not necessarily think about breast cancer initially. These kind of things should all weigh in, because things like risk factors put into a question are not there just for filling space. They're there for you to get thinking in certain ways. So increasing age, of course, family history of breast cancer, BRCA 1 or 2 mutations, early menarche, late menopause, dense breasts, being overweight, history of alcohol, use of certain hormonal treatments. Again, all these should make you start thinking about the potential, or are they trying to get me to think of a potential breast cancer scenario. So what does the referral criteria say then in terms of the NICE guidelines? So there are a couple of situations where you should refer for 2 weeks, definitely refer for 2 weeks. These should stand out in a question. Over the age of 30 with an unexplained breast lump with or without pain. So this is why A is a definite referral. 34-year-old with an unexplained breast lump with pain. A lot of people might read that pain bit and be slightly put off and think, well, that's probably not going to be an urgent referral. But when you look at the criteria, it's with or without pain over the age of 30. But also the other one to remember is anyone aged over 50 with a unilateral nipple symptom, whether it be discharge, nipple retraction, other changes like Paget's disease of the nipple, for example. But anything that's unilateral, age over 50, then you should think about referral. There was one similar to this. There was a 49-year-old with unilateral nipple retraction, and again, you might well do an urgent referral for them, but according to the guidelines, it's not a correct answer. There are a couple of situations where you consider a 2-week referral, but they're not definitive ones. You consider them. Skin changes that suggest breast cancer. This could be things like peau d'orange, for example, a classic thing that may make you think about breast cancer underlying. Or age over 30 with an unexplained axillary lump. And then consider non-urgent referral in anyone under 30 with an unexplained breast lump with or without pain. So remember, 30 is the number to remember. So if you're above 30 with an unexplained breast lump with or without pain, it's a 2-week referral definite. If you're under 30 with unexplained breast lump plus or minus pain, then you consider your non-urgent referral as per the guidelines. But of course, you may decide that this person warrants an urgent referral anyway, which is fine. So let's go through the other 4 then. So we talked about B, why B is not a right answer. What about C, a 43-year-old with unexplained unilateral mastitis? So this doesn't come under the urgent referral criteria. According to NICE, a 53-year-old with bilateral breast pain, so the bilateral bit here probably goes against it, and therefore it wouldn't fit into that criteria. And then a 25-year-old with unexplained painless breast lumps. So the 25-year-old would fit here, wouldn't they? Under 30, you'd think about a non-urgent referral, and sometimes here the painless bit almost becomes more powerful than the age. So a lot of people would put E as the right answer. So the painless bit here would put this ahead of the painful bit here, whereas it's the age that changes A from a wrong to a right and E from a right to a wrong answer, as it were. So hopefully you can see now why A is the answer that stands out here, even though on first glance, and we talk a lot about how our brain makes decisions very quickly, even on first glance, you'd probably think B is a higher risk, or even E because of the painless. But when you break it all down and you see beyond those initial gut reactions that kind of throw themselves at you, then you realize that A is the one that fits the guidelines. So a bit more about breast cancer just to finish off this teaching session then. So there's a couple of different types. You have non-invasive breast cancer, carcinoma in situ. So this is when the cancer in the ducts itself, versus invasive breast cancer when it's gone through to other parts of the breast and beyond as well. These are all things that will be picked up in secondary care and found out through further testing and imaging and biopsies and things like that. And lots of management options and treatment plans based on many different things. Surgery, of course, it could be breast conserving surgery, it could be mastectomy, or things like sentinel node biopsies. Radiotherapy, of course, chemotherapy, of course, usually after surgery. In certain situations, hormonal treatment might be needed, things like tamoxifen for your hormone receptor positive cancers, and then in some cases biological treatments as well, trastuzumab for your HER2 positive cancers, for example. So if you get questions in AKT about management, it may be about things like side effects and problems people are having with these things, but it may also be about different options that might be used in breast cancer based on different bits of pathology that might be found from further testing. So breast cancer, just like any of the cancers, make sure you know your 2-week referral guidelines. Please do have a look at those YouTube videos to go through them if you haven't already, or look directly at the NICE guidelines themselves. Know about the presentations of the common features that should stand out to you in questions, so you don't miss the possibility of a cancer in terms of a question and answer, and know a bit about management plans and how they differ from one cancer to another. And again, we cover all of these in our audio courses and in our online courses as well. And talking about the audiobook courses, another reminder about how these can help you save time, really buy time when you're preparing for AKT. A lot of people use our other resources like the online courses where you have to sit down and watch and go through things on a screen, but the audios are often used at times where you wouldn't really sit there and do work. So when you're commuting to work, when you're shopping, when you're out doing exercise or whatever it might be, you plug in, switch play, and you just start to learn things on the go, passively sometimes. We have 3 different audiobooks, as you probably know by now. We have a clinical, a stats, and an admin, all broken down into chapters that you can just flick to whenever you are hitting a particular topic. No expiry on these. Any updates that we do, you get updated for free without any limit. And please do make sure you use the coupon again, Arora Video 10. A lot of you guys have been taking advantage of this over the last couple of days for the AKT stuff. Arora Video 10 will get you 10% off either the triple bundle, which is already discounted, or any of the 3 single ones, depending on what you have left to cover before your exam. Really hope this helps. Look forward to seeing you guys on day 10 tomorrow for the Arora AKT 30-day challenge. See you tomorrow.